Dr. Dhoon is a surgical instructor with the Colorado Surgical Institute, a black belt coach with the Dental Success Institute, a surgical digital faculty member with the Dental Success Network, and an author and coach of the Practice Launchpad. Here to talk about advanced clinical procedures, please help me welcome trainer, author, and coach, Dr. Taher Dhoon.
All right, so we are going to be talking about advanced clinical procedures and how to implement these into your practice. I'll tell you right off the bat, this has absolutely been a game changer for me and the trajectory of my career. And a lot of you guys in here have already come through the Institute and can be a testament to like what this can actually add to the mix. Initially, I was listening to a podcast about just locks and keys. I have a 6-year-old who's interested in really anything. So we just Google stuff from time to time, listen to podcasts, and he was bringing up locks and keys, and we just dove into this stuff about how they were invented 6,000 years ago. It was an old wooden lock, and then you have to fast forward to the Roman Empire to see the next rendition of this lock. And then later down the road, this technology is lost forever up until 1774 with Robert Barron. And so it got me thinking, my head always goes into dentistry and the application of dentistry and clinical procedures, even if I'm listening to a podcast with my 6-year-old. And it just dawned on me that if someone was there passing down the knowledge as a mentor and not allowing things to just die and be forgotten, that what could this technology be now? And so what we're going to discuss today is ways to tie into mentorship, to learn from your elders in a way where the knowledge is not lost, taking that and then folding time, like our friend Alistair McDonald likes to say, to improve the quality of your practices and your careers. So what are the locks blocking? And Dr. Brisky, myself, and Mark are in a very unique scenario where we get to talk to people all the time about the things holding them back from implementing these procedures in their practice. But first, let's define what exactly is an advanced clinical procedure. So, single implants, orthodontics, a full arch of implants. It could be full arch of crown and bridge, right? If you're doing VDOs, if you're looking at centric relation, if you're expanding the arch for airway analysis, whatever the case may be, these are advanced techniques in the practice. Quite frankly, if you guys haven't taken Aaron Nicholas's course about root canals, all my associates go through that. That is the fastest way to get an ROI, is to do an hour molar root canal buildup in crown. When he goes on Facebook and posts that he can actually teach someone to do an hour molar root canal buildup in crown, people on Facebook threads lose their minds. And it's just interesting to read some of those comments. But I've seen him do it time and time again. And I would highly recommend looking into his course. So from the perspective of what holds people back, complexity is holding people back. If you look at the complexity of these procedures, it can feel really daunting when you're like, okay, I gotta get my preclinical records, I gotta reduce the bone, I gotta place implants, I gotta navigate around the sinuses, I gotta do my multi-units at a certain angle because the patient's airway is gonna obstruct, whatever the case may be. The ways to truly get over complexity is through mentorship, and I'm gonna sound like a broken record by the time this is done. It's through mentorship and finding people who actually genuinely want to teach. All right, Dr. Brisky and myself, we love to teach this stuff. It's like what lights us up. But you can also find periodontists and oral surgeons and other just established general dentists in your area who know what they're talking about, who will allow you into the operatory, who will show you the things that you need to learn to get through the complexity. Also, you need repetition. A lot of doctors, they'll tell us hey, I don't see enough of these cases to get the reps in my practice to actually get good at it. So what you need to do to get your reps is you need to go to a course and just dive into it over a weekend, but you need to go home and you need to do these cases not for free. I'm never an advocate to do these cases for free, but calculate your profit and your overhead and charge the overhead on the case. Everyone's overhead is going to be a little different. So look into the numbers in terms of what it costs to heat and cool your facility, all the way down to the lab bills on this stuff. Figure out that cost and charge the patient. Now, optically speaking, what you're going to tell the patient is we have a marketing opportunity. What we would love to do is tell your story to people who are like you, who are on the sidelines, who are scared to do this procedure, or who think that they aren't candidates for this procedure. You get an ironclad marketing release. You can reach out to us and we can send it to you. It's the ones we use on our TV commercials. And have the patients record pre-surgically their experience and what has led up to where they are today. They're going to tell you some really intimate things, and it's a very vulnerable conversation. And you have to be able to be present for these conversations and get the footage and ask the questions and just allow them to share what's authentic to them. So that's where you start. And then you get your post-operative videos and you get your pre and post photos and you build your marketing vault, essentially. So I would take 1 month out of your career, maybe have a bad P&L, right? Jake and Mark aren't going to like that I said that, but have a bad P&L maybe for 1 month, build the reps in your practice. Your administrative team will get the reps on how to finance the cases, how to market for the cases. Your DA team will get the reps on how to do this stuff, and you'll have a bunch of cases you can push out through marketing on social media to attract patients who are like this. And then you have to be able to reach out to your mentors after the fact. Dr. Brisky and myself, we've taught over 100 dentists at this point, and we've treated over 500 patients through the Institute. We do 3 to 4 calls a day with docs who are alumni for the course, and they will call us and say, hey, this is what I'm experiencing in my practice. This is the complication I'm having, and we can help you walk through the steps on how to solve it. And to date, I'll probably knock on wood saying this because I'm only superstitious about sports and dentistry, that we have always been able to help our alumni kind of navigate the waters. Because I've been doing this procedure for over 11 years, I kind of know this thing in and out, and we will help you get to the finish line, but you have to reach out to us to get the help. The next thing holding people back is the dental culture. It depends on the geographic area you are in. It depends on the dental school you went to. It depends on when you graduated. But there's a version of us being told as generalists that we can't do these procedures. Now, I'm always going to stand from behind the podium and say, we need specialists to do certain procedures. I will still refer certain cases to my specialists. 100% the specialists have a place inside of dentistry, but they just get the hard cases, right? They earn their stripes, they get the hard cases from my practice, and when they see the referral slip coming from us, they know, they better eat their Wheaties that morning. The dental culture, there was a time where marketing in the yellow pages was viewed negatively. And if you marketed in the yellow pages, you were a pariah. You were breaking the culture. You should not be doing that. And I think all of us will stand here today and say that was an antiquated way of thinking. And now I think the pendulum is swinging so far the other way when it comes to super GPs and generalists doing these procedures, that we should all do these procedures if you want to. If you like the GP stuff, other stuff lights you up, I'm not saying do surgical procedures and complex procedures if you don't like to do them. But if you have an interest in doing it and something is holding you back and something culturally is maybe holding you back, I think I would challenge that statement all day long. I think being in this room, I was here in 2018 as a DSI member, as a new inductee and attendee. And I think one of the reasons why I've been able to have the career I've been able to have is, I'm looking at Trent again up front, but we started DSI together, right? Joining DSI and starting this journey with people who are on the same trajectory as I am, who have the same level of ambition that I have, and we're trying to aspire to something more than what we were currently told we can be, that we could do, has really motivated my career. So what I would recommend from a dental cultural perspective is find mentors who truly like to teach and become successful, because that is the way that you say thank you to them for spending time with you. Find a group of people who are on the same level as you, so you guys can pace with each other and push each other. And then I would encourage everyone here to look back and find someone who wants to be in your shoes and teach them. Because the thing is, you're going to get 2 things when you do this. A, you're going to help them and you're going to change the trajectory of their lives and their careers, and it is absolutely fulfilling on so many levels. But 2, you have to inherently know subject matter very intimately to teach it to someone who doesn't understand it. Fear, anxiety, feeling like you're not enough, whatever the case may be, if we just look at it through a general funnel of why people don't do these procedures, at Colorado Surgical, what we do on the last day, everyone's a little bit tired. We've been doing surgery, all weekend. We just sit round table with all the attendees and we just kind of talk about what's holding us back. What are the things keeping you from implementing this in your practice? And we ran a course last weekend, and around the table, I'd say about 75% of people said a version of fear and anxiety of not feeling good enough to do the procedure is holding them back. What I will say is in the beginning, yeah, you're not going to be as good as the person doing it for 10 years. Like, we all know that. Your patients want you to do these procedures for them. They have a relationship with you and your team, and they want you to do the procedure. Number two, you can reach out to your mentors and they will walk you through these cases and walk you through the complexity. And in the beginning, if you don't feel like you're enough, do the case for free or do it for profit. The patient wins and you're going to win, and then you're going to have the skill set for the rest of your career. And then the cost. We've addressed the cost of the patient and how to take care of that issue. And then the cost of the CE. The cost of the CE is always going to be less expensive yesterday than it is going to be in the future, and you will have that skill set forever. The one thing that I did not anticipate through this journey is this connection, this profound connection with your patients when you do advanced clinical procedures in your practice. So Heather here, she tells stories about how she touched Elvis's leg at a concert. Louder than life person, tattoos up and down. We did very multidisciplinary treatment with her. It was ortho and veneers and root canals and implants and VDO changes and all of the above. And she sings our praises all up and down Greeley. And she ended up actually working for us. She retired, came out of retirement to work for us, was the mother hen for a little bit, and then truly retired later down the road. When you allow yourself to have these conversations with your patients, your connection with your team is going to improve as well. There is something that you bond with people when you go through giant obstacles and you solve puzzles together and you retain your team for years and years. The connection component, actually, if you have whipped cream in your ear and nose, clean it out quick, because that will dry and you will smell that for like the next hour. So the connection to the team. Oh, can you roll the video, please?
My name is Rose. I'm the implant coordinator here, and my role here at the office has changed exponentially. We've added so many procedures to our office, and that has added so much value for the patients. The biggest thing that it's added is a one-stop shop for our patients. So they don't have to be referred out to every other office, and our patients really enjoy that.
I think it's a bigger relationship connection with them, their family at that point. You've changed their life so much that they really enjoy coming to see us. It's not that fear, that scare anymore. They really want to come see Dr. Dhoon or myself because we did something so big for them. A lot of our patients, before they do any of this procedure, have never went to a restaurant to eat or always wanted a gym membership and never gotten that because they were just so embarrassed to smile. And now they're out in the community at their kids' games or getting gym memberships, going out to restaurants, and they send us pictures. Like, a lot of our patients have our personal phone numbers, what they're doing when they come in. We're laughing in the operatory with them. All the other employees want to have that relationship with them as well, but don't have it to the extent that we do because we were side by side in surgery with them. So I would say, culture is the biggest part in being able to provide these procedures for patients. Patients come in and they feel that divide, like front desk doesn't get along with back office, or back office doesn't get along with the front desk, or DAs don't get along with the doctors, then they're not going to want to be here. They're not going to put the trust into the office, and they're not going to pay thousands of dollars for something that they don't have 100% trust in.
Because we do the implant consultations, now I'm actually able to teach other offices how to do the implant consultations from start to finish. I have office managers calling me and asking me questions on a daily basis. I can fold time for them.
So of course, The courses that we run, bring job offers to the table, and it might be more hourly than what I'm making here at Greeley Dental Care. But what keeps me here is the relationship that I now have with Dr. Dhoon. The reason why I say that is because we did not start off on the best patch, but we found our way through, and now we have a hate-love relationship. And of course, these procedures that we do. We are not a normal dental office, but that's what keeps me here, is not knowing what I'm going to come into every day. As fearful as that might sound to some people, that's what I enjoy. I don't want my everyday to be the same thing. I want it to be something different. I want to be able to overcome those obstacles and be like, yes, I did that. Yes, I got my team through that. That's what makes me continue to come here.
So you will absolutely hear from your team that this stuff lights them up. And Michaela gets job offers all over the place. Rose gets job offers to go other places. They don't want to leave to go to a place where it's the same thing day in and day out. They will stay with you because they will have these profound moments. And the more you do this in your practice, the more you're going to experience these conversations and transformations with your patients. And so what does it do for your team, right? There's obviously continuous learning, self-development, improves the team morale. It develops a mutual respect and trust amongst the team because everybody is doing complex things and everybody thinks and knows that everyone is pulling their weight. And it is extremely evident when people are not pulling their weight in a practice that does these types of procedures. And then team longevity. I like to consider my team in terms of orbits. You got your third orbit, your second orbit, and your core first orbit group. And what I've found through implementing these procedures is that my core group, my ride or die, is growing and growing and growing. And then from a career perspective, sometimes in dentistry, right, you can't move up the ranks. It's not like certain industries, but it allows them to grow. And from a financial perspective for us, you're going to make way more revenue implementing these into your practice. And then as a byproduct, you can pay your team more. And on top of that, you're going to feel good about paying them more. I've never done a Medit scan. I've never done an iTero scan. I've never printed or milled or done a CBCT in my practice. My team does everything for me. And we've had the systems down to the place where I just do the surgery, bone graft, suture, I leave the room, they manufacture everything, they deliver the prosthetic, they adjust the occlusion, I come in and dial it into CR and just kind of take some of the credit or all of the credit. And I have a very good job because my team allows me to do these things and they make me look good. And because I took the time to train them. And then obviously career-changing skill sets. This dovetails into their personal lives. I've had some of these team members for years now, and it's cool to watch them start as, young kids, as I like to call them, and then become young mothers, and then take that confidence and that skill set and solve problems in their personal lives. And it's been a privilege to watch them kind of grow up in the practice. From a community standpoint, your patients will sing your praises. Now, it's a completely different subset of skill when you have these conversations with these patients. They are coming in and sharing some of the most vulnerable parts of their lives. Now, we all have baggage. We all have trauma to some degree, some kind of damages that have occurred through the years. The thing about the patients that walk into your practice is theirs is front and center. Theirs is there for the entire world to see. You look at any magazine, cosmetic magazine, what do they say? That people, when they meet you, they look at your eyes and they look at your smile. They will make assumptions on your intelligence. They will make assumptions on how you live your life. They will make assumptions on how you are as a parent when they have a failing or terminal dentition. And so what happens to patients, I do these conversations like 4 or 5 times a year, and it's really allowed me to kind of have this insight into human nature. And what they'll tell you is something like what addicts will tell you. They'll say, how did we kind of end up in this position? It was slow at first, and then faster than I could have ever have imagined this happening. And then they retreat into becoming a shell of themselves. And then they don't go out with their friends and family. And then they don't go out to dinner with their friends. Or if they do go out, they cover their mouth or they try not to laugh. And then now people start confusing them as unhappy people. Well, they're not unhappy people, they just don't smile and laugh with their loved ones. So then when you are able to give them back their sense of confidence and self-esteem, and they get to be this larger personality with their friends and family, those are the patients that will talk about you in the community. Those are the patients that will smile and their friends will say, something has changed in you, what happened? And I went to Dr. Dhoon. The sedation patient who picked, the driver who picked up my sedation patient from Tuesday, he was like, oh yeah, you did my buddy's teeth at Walmart the week before and he looks amazing. And he asked me, do you do single implants? I was like, yeah, I do some singles too, man. Let's get you scheduled. So it's like these patients are your brand awareness. They are your walking billboards. They will sing your praises when you do these types of procedures for them. So from a practice perspective, you want to be the one-stop shop if you can be. You'll take care of your patients. They don't have to go see the specialist. They have one financial plan with you. More repeat appointments means more revenue. And then generational patients. This is a part that also kind of caught me off guard in terms of its impact into my life. When you can take care of their kids when they're newborns, 6 months or whenever you decide to bring them into the practice for their fun visit. And then you can take care of their ortho. And then you can do their IV sedation and take care of their wisdom teeth. There's a kid last week. He was this scrawny little, beanstalk of a kid at one point, and now he's a wrestler. So I did his ortho. Now he's completely jacked and ripped, doing wrestling. I put the IV in, pushed 2 milligrams of Versed. He starts getting all giggly, and he just starts telling me, he's like, dude, you've been my dentist forever. You did this for me and this for me. And I don't feel like I'm an old dog or anything. I've been doing this for 11 years, but the way he talked, it was like, hey, we have this profound connection because I've been his dentist for years. And so if you can incorporate these things into your practice, right, later down the road, maybe I'm doing this long enough and he's in the area long enough, I take care of him and then his kids, or I take care of his parents when they have a terminal dentition, and take care of his grandparents and great-grandparents when they're in the aged living facilities, and then you kind of just help them maintain a sense of health up until the finish line. So the generational impacts are absolute. There's obviously enhanced aesthetics and self-confidence. Someone explained something to me about self-confidence and self-esteem, and the definition between it's the best one I've heard so far. So self-confidence is the way you feel about yourself with all the things that you've created, all the accolades and everything that you have kind of earned with your merit. And self-esteem is the way you feel about yourself when that's all stripped away. And it's very cool to be able to give that back to patients and to have them have that so quickly. If you do a surgery and they get their teeth the very next day or even that same day, the impact of the degradation of their condition for 20 years, 10 years, and then the impact of seeing that after one sedation is profound. And then obviously the patient experience, comes first. So I think we're coming up on a video with Sherry, and I'll have you roll it in just 1 second. But Sherry's story here is it's amazing. She was born with cleft palate, cleft lip, legacy patient of the practice before I took over with the acquisition. She actually has a hole in the roof of her mouth that goes into her nose, so oral nasal fistula. And she had a denture and had failing dentition on the bottom. And so everyone in this room who understands dentures or understands how an upper denture stays in place, it stays in place because of a suction that's formed. Well, if you have a hole in the roof of your mouth going into your nose, every time you breathe, it's going to dislodge your denture. So she would have to put so much adhesive into her mouth that it would actually have to coat the base of her nose. You could see adhesive in her nose, so she could just live and be out in public. And so me and Sherry have been together for a long, long time, and we finally got to the finish line. And then, yeah, go ahead, you can roll the video here.
Well, I was born with a bilateral cleft lip and palate. She actually went into labor at home, and the afterbirth had come out, so They rushed us to the hospital and they had to give her blood transfusion. So it was either we were both going to die, one of us. It was pretty serious. So after I was born, of course, back then they didn't do ultrasound, so they didn't know I was born with this defect. And so because of the blood transfusion, she was out of it for a few days, so didn't realize that I had this. And I guess I was placed in a nursery with quite a few other babies. They didn't want to tell my mom right away because they didn't want her to go in shock. I guess it would, yeah. So when they told her, I guess the doctor, had said, well, if it would have been a boy, it could have had a mustache. So that was kind of hurtful. So I've been coming here for years. So that's how I met Dr. Dhoon, because he started here. Just the regular dental stuff. He made a denture for me and, just the regular checkups and things like that. And then one day he came to me and was telling me about this program and how they could do these permanent dentures. They would offer that to me. And so I got so excited. I mean, it was just, yeah. I was like, okay, let's go, let's do this. I went ahead and took equity out of my mortgage so that I could do this. And it was, it has just been life-changing. Like, I can't even tell you. It's life-changing. I can eat what I want. I can, I don't have to use that denture cream anymore. I feel more normal. Dr. Dhoon and the whole team has just been amazing. It was not, I'm not gonna lie, it was not an easy road for me because it was a little extra because of my birth defect. It was a lot extra. At times lose patience, things like that. Dr. Dhoon and I would get little tips once in a while. But, he is amazing. The whole team is amazing. I can't thank him enough.
I like how every video they tell a version of me being a hard ass. So yes, you do have to be a little bit of a hard ass to implement some of this in your practice, but also a sense of calm and patience with certain things too. So connection with your career. This stuff has changed absolutely the way I see my connection with my career. Or purpose, or fulfillment, or what you want to do with your life. This is the thing we've chosen to do with our time here. And so if we can impact people in a major way, I think if it's interesting to you, you should consider it strongly. We all know it's not always easy being a dentist. We are the CEO and CFO and CMO, and you're the C-suite and the clinician. It's hard. And I'm going to change. It's not most times. It's sometimes. It feels like a thankless job. And when sometimes happens too frequently, then in your head you maybe say most times. But it's sometimes a thankless job. But I guarantee you that that sensation or that feeling of it being thankless goes down significantly when you get to do this. So, of course, it's changed a lot for me. Purpose. I think intellectually, we all know the feeling of what our purpose needs to be. And then from an emotional standpoint, if you actually find it, it's a very different feeling. And I don't quite know, I don't have the lexicon to describe what that feeling is in itself, but I can tell you that I found it through these procedures. Relatively clear direction. I think the vision changes from year to year, but I definitely know that there's a vision in place. And I'll guarantee you, I am excited to be in the office. These surgeries light me up. I am waking up before my alarm goes off. This is all I want to do. I'd rather have an empty schedule and do this stuff than some of the traditional stuff. Now, just to keep in mind, I still do general dentistry. I still will prep a crown. I will still do fillings. I will still scale teeth if I need to, because at the end of the day, you got to be scrappy. You are running a business. You have to do what it takes to run that business profitably. So just a few numbers before we kind of dive into it. I was kind of going back and forth whether I should share this number or not. I just figured I wanted to, hopefully with some humility, kind of tell you what's possible with implementation of these procedures into your practice. So currently speaking, I'm 2 days clinical per week. And on those 2 days per week, the collections is north of 2.5 million. So you can do these procedures in your practice, do them efficiently, make it profitable, and then kind of design the schedule and the lifestyle that you would like to have. And then on top of that, the impact that it can have and what you learn about yourself through this. Like, I go to the office and I exercise this muscle of connection and presence and purpose all the time. And I'll share with you guys, it was a very unexercised muscle. And then I go home and I get to dial in with my family and my kids and my wife. And I am a better version of myself because the muscle is getting exercised on a more frequent basis. So from a general perspective of just numbers, if you charge $6,000 for an ortho case and you do 5 starts per month, you can generate an extra $360,000 in revenue per year. I didn't do profit because everyone's overhead and profitability is going to be slightly different. Sleep apnea, if you're at $3,500 per case and you do 5 starts per month, that's an extra $210. I think some of you have already kind of pieced it together where these 2 procedure mixes, you probably are going to get paid over a payment plan. What we figured is these procedures have a very low default rate. So view this as like an annuity payment, right? The monthly check comes in and you're just collecting those things on a monthly basis. In the beginning, the profitability and the cash flow through your practice is going to be maybe negligible with these procedures, but you will hit a swell where you can maybe, God forbid, get injured or take a month off or sit at home for a month and read a book, and you can have these checks rolling in from these 2 procedure mixes. And what's amazing about these procedure mixes is they are 90% assistant driven. 90% assistant driven. I do the training first, do the diagnosis, and then I do the debond. And I'll go check in, and I'm like a politician. I'll just kind of shake hands and kiss babies type of thing. Wisdom teeth and single implants, I I really downplayed these numbers. I just wanted to show you what these numbers could be in terms of what's already in almost every practice in this room. So from that perspective, if you do 5 starts on wisdom teeth, you get an average of $2,000 per wisdom tooth case. 5 per month is $120,000 in revenue. Implants, 5 per month at $2,000, again, an extra $120 in revenue. I figured the abutment and crown you would get it either way if you send it out to the specialist. But keep in mind, there's doctors in here like Sean Custer who can do 4 cases of wisdom teeth per hour. And then he does that times 6 hours. And if you do the calculation on that, you don't have to do too many days clinical to have a very good, career. And then full arches, this is the part that lights me up. Yeah, it's a little bit more involved. It's a little bit more complex. There's more nuance to how you handle the prosthetics. But if you do $25,000 per case and you do 1 case per month, I guarantee you there is 1 case per month in every practice. That can be $300,000 per year in revenue. And in the beginning, your lab bills are a little higher because you got to figure a few things out. But all in all, this is something that's in hopefully every practice here. I would say theoretically, if we're looking to standard deviations, the vast majority of you have this in your practice. It's an extra 1.1 in collections that can be done. So how to make it happen? The networking. Remember, find mentors who want to teach. Some people truly want to give back. And quite frankly, I've been in a lot of different groups. This group has the most giving black belts. I still do my coaching calls with a lot of the black belts. And they're coaching me on helping me spend money on a Disney cruise for my kids to just make that decision process okay. You can talk about this with anyone. They'll coach you on anything, the personal and the financial. But find coaching to help push you in the right direction and solve the problems for you that they've already solved so you don't have to recreate the lock. Get a group of people who are in the same stratosphere of where you are, and then go find some people to teach as well. Continue education. Obviously, I got a dog in this fight, but if you come see us at Colorado Surgical, we can get some kind of discount for you guys. I should remember what they were offering. Chris and Roxanne know that information, but I do know we have some kind of offer for the attendees of this course. And then invest in your team. You are just as good as your team, okay? If I don't have Michaela in my surgeries, they take an hour and a half. If I have her in my surgeries, we're doing these things in like 50 minutes. So the quality of the person who is there to put you on their shoulders to be better at what you do is going to be your team. And it's not a financial investment all the time. We signed up for an office softball league, and we have bonded through just doing that. And we got our butts kicked last Wednesday, and we still had fun doing that together also. So I think everyone here should strongly consider doing it if you have any interest at all. It doesn't matter the route you go. I want you to know that you can implement this into your practice. You do need the reps, you do need mentorship, and you do need to just get off the bleachers and get into the game. So, thank you. All right, and so we are going to bring out Dr. Brisky and Dr. Costas and talk shop on a few things.
Let's hear for Dr. Taher Dhoon, first of all. And he's been manning the Colorado Surgical Institute booth all weekend, but we've been talking about him a lot, right? This is Dr. Dan Brisky. Let's welcome him to the stage as well. Yeah, you got it. So I got to tell you guys that I've been around the block a few times, and I've never met two more capable and accomplished surgeons than these two guys. So when we decided to create Colorado Surgical Institute, it was with these guys that, of course, I was comfortable collaborating with. We spoke about this a little bit yesterday, but Colorado is one of the few states that allows you to get a temporary license. So you actually put your hands on patients, pre-screen patients. And the benefit of a Colorado Surgical Institute, something that's here stateside, is that the patients are actually screened at Dr. Brisky's office or Dr. Dhoon's office. So there's an actual real DDS that's actually putting the treatment plans together. And then there's follow-up care, and there is a restorative plan for every single implant that's placed. So if you guys have ever gone overseas, some of those courses are amazing. They guarantee sometimes that you're going to place 30 implants. I've been to these courses. You look at the post-op, and it looks like a pom-pom in there. They're just going every direction. You're following the bone, and they're getting the minimum number of implants that they promised you would be able to place while you're there at this particular course. There's no pre-screening, there's no post-op, and there's no restorative plan for these poor patients. They actually get paid to come in there and get titanium put in their skulls, and there's no follow-up whatsoever. So ethically speaking, I question some of those courses. But when you do it in a setting like this, you know that these patients are people that typically couldn't afford this type of treatment unless there was this type of environment. It's here stateside. It's with some of the best surgeons in the world. It's true that students are going to be doing the work, but somebody like Dan or Taher or myself is standing right over their shoulder to make sure that the angulation is correct and they're doing everything really, really well. So in an environment like this is what we often say, in an environment like this, sometimes it's safer to get major work done in an environment like this than it is in a regular dental office. So I can confidently say that the patients are getting the best care, and the people that are going for training are getting an unbelievable experience and lots of reps. Because there's no shortage of these types of patients that need this type of work. So Colorado Surgical, it's one of my favorite places to be. I'm there at least, 9 times a year now. For the single implant course, we have a wisdom tooth course. We have an all-on-X course. We're gonna start a lateral sinus and block course. And now we have IV sedation, which Dr. Dhoon's brother is a board certified medical anesthesiologist, and he helped us put together the IV sedation course, which will be starting in June. So anything that you guys want as far as advanced surgical education, you can find at Colorado Surgical Institute. Dr. Brisky?
And Mark actually mentors rooms now, everyone. He is actually on our level now. So
It's not even close. Close.
He's dropping full arches now. Like very, very talented guy, this guy is. But I just encourage everyone in the room to figure out what's keeping or holding you back in terms of surgery or whatever you want to do with your life. My passion is teaching dentists. We all do things for patients, right? In the end of the day, that's why we're dentists. But I do it because I can change the trajectory of someone's career. That is what makes me smile and what makes it fun for me. So,
yep. Both wet-fingered practicing dentists. These guys do it every single day. How many arches do you think that you do per month, Dr. Dhoon, in private practice?
12 to 15.
12. How about you, Dr. Brisky?
I just opened this month, but I closed 5 cases.
Wow, unbelievable. Congratulations. All right. So I just wanted to give my full endorsement to these guys. It's really a very, very cool environment. I've never experienced anything like it, and I've done hundreds of hours of clinical, surgical, continuing education, and this is the real deal. It really is.
Or if you guys want to send us your patient too, you have someone that you really love. We all have someone in our practice. We're like, man, I really want to take care of them. Go ahead and send us to them, and we'll do the surgery, and you guys can do the restorative when you get back home.
Yep, and for you team members, there's also opportunity for you guys to come with your docs to learn the surgical side of assisting. And for all of you students, there's lots of opportunity for observation and to help us suck spit.
Or just play Dr. Dhoon and beer pong at the end of the weekend.
Yes, there will be beer pong.
Yep.
All right. All right, thanks guys, appreciate it. Hillary's coming up. Thanks guys.